Action.
Good afternoon. I'm Dr. Joel Levy, and I'm going to give you a brief introduction as to what we're doing to keep you safe, keep staff safe, and make it a pleasurable experience. Even though in these times when people are so afraid of everything, they're worried about giving it, they're worried about getting it, they're worried about catching it. So we have to really go above and beyond to try to make it a good experience. So we've gone past what the CDC has said, past the World Health Organization, past the ADA, AGD, NYSDA. We are implementing anything and everything to make sure that we're on the cutting edge of keeping you safe. So with that in mind, we started off with apparel. There is PPE apparel, which is personal protection equipment apparel. We likewise are changing, of course, after every patient. Don't take that for granted. In these days of not being able to get supplies, there's a lot of reuse of things. We're doing our best not to reuse anything. We're using fresh stuff with everybody. Likewise, no more no more outside clothing in the office. All of our clothing is scrub related, antibacterial, washed nightly, so you're getting a fresh me when I sit down, entirely clean. Starting off, we go through the operatory. Every aspect of the operatory is either sterilized, disinfected, or covers are thrown away. Chair is covered, every patient. All instruments, of course, autoclave, but beyond the autoclaving, we have different suction machines. We have a room sanitizer which will filter out the air in 15 minutes.
Where is it?
What?
Where's the room sanitizer?
Glad you asked. It's right over there. So what that does is actually, it's a medical company that has triple HEPA filtration. It will filter out, and then it has UV light, which will then sterilize the contents. So it will filter out the air in this size room in 15 minutes. So some of the modification, there's hardware modification, there's software modification. The hardware modification is the room. The software is what are we doing in addition to the hardware. And the software would be, for example, all patient appointments have to be extended. Things take longer, more explaining. So in lieu of that, we make their appointment longer. We also make the appointment longer because there is a half hour between patients to clean the room. Even stepping on the floor before you walk out the door, the patient now will be asked to wait until we go ahead and disinfect the floor so you don't track any aerosol out. Then we do our job in here. Patient comes out. We respect the 6-foot barriers. So the barriers are put in all different locations. We've started using a very interesting device which has been around for a while, but a lot of people don't really know about it. And it's called the Lightwalker laser. And the real advantage of that is, number one, you can minimize aerosol with it. You can also treat cavities with no Novocaine and no pain. So it's a very novel idea, and the fact that it works so well, we're just thrilled to death. So it adds another dimension, but getting away from trying anything that produces an aerosol is a great thing, and we can control that. What else? So another interesting thing that we added was our face shield, obviously, which goes over the mask. It will prevent aerosols from getting to the mask. So basically we can see what aerosols are created or how effective our other hardware procedures are in preventing things from getting to the mask. So at the end of a treatment, if it's loaded, we haven't been doing our job. This essentially stays pretty clean. So beyond this, nothing gets to the patient, nothing gets to me. So that's worked out pretty nicely. Aside from that, everything else barriered, cleaned, and we look forward to seeing you anytime you're ready. We will keep you safe. It's our commitment to you, commitment to our patients, commitment to our staff. And we wish you well, and we wish that all of you should remain safe. So thank you for giving me your time and attention.